I'm feeling fine. Can't I just stop my medications until the pandemic blows over?
Yes, I think this has been covered quite nicely by a lot of the different panelists in some ways. But the main thing to remember is that when we look at the risk of complications, particularly of infectious complications in patients with inflammatory bowel disease, the main risk factor is having disease that's not in control. And so we know that if you stop these medications, there is a much increased chance that your disease will become out of control. So if you're doing well, let's say you're on an injectable medication or you're on infusions, or even if you're on pills, if you stop those medications, we know there's an increased chance you're going to flare. And we know that when people flare, they're more at risk of ending up in the hospital, which is definitely a place that you want to avoid right now. You're more at risk of needing to have surgery. You're more at risk of just feeling unwell and potentially becoming malnourished. We know these are all risk factors for infection. So the best thing you can do is to do what works and to keep your disease under control. And if that means that you're on a medication, maybe you're on Remicade, maybe you're on Imuran, maybe you're on an injectable medication, whatever it is, it's best to stay on it. And keep in mind as well that most of these medications, particularly the injectable medications or the ones you receive by infusions, are going to hang around in your body for a fairly long time. So even if you decided to miss it today, it would still be in your blood system for quite some time. So it's not as though you can immediately filter it out. So I think for all these reasons and more, if you're doing well with your disease, do not make changes to your medications. And also, because I know not all of you are maybe able to see your IBD specialist immediately. If you go to your doctor and they have the inclination to stop these medications, I would strongly caution you against that, or if you're unsure of that advice, to try to get a hold of your inflammatory bowel disease specialist or your gastroenterologist to try to better address those questions.
Just to give the audience an idea, because I think Gil showed some of this as far as the IBD registry. Out of the 14 patients that we know are on in the registry right now, 11 of them were on a biologic alone and or on an immunosuppressant. And most of those patients did with documented disease, and most of those patients did quite fine, not even requiring hospitalization. So that's giving us a little bit more confidence, even if you got the disease in the context of being on those drugs, that you're going to do